1 in 8 couples struggle with infertility. It can feel hopeless and isolating and make one feel inadequate and even broken, but this week highlights the efforts of professionals who say, don't give up. Let's welcome back Dr. Heather Cook, Reproductive Endocrinologist at Coastal Fertility Specialists. It's great to have you back.
Thank you so much for having me.
So this is an important week for patients that you see on a regular basis who are struggling with infertility. So why is it important to highlight it?
So it's really important, especially for an infertility diagnosis, because I think it is one of those medical conditions that does tend to have a lot of shame and embarrassment behind it. And so patients are very afraid and fearful to actually go to their doctor and say, hey, we've been trying to conceive and we've been struggling, and actually just take that initial step to seek help into kind of following that path forward with treatment and evaluation.
And if you were to take the entire population, it's pretty even between men and women who suffer from infertility.
It is. You know, everybody thinks because we're the gynecologists that work with these couples that it's a female issue, but a lot of times it's not. You know, we see about 1/3 of the time it's just the females, 1/3 of the time it's just a male factor, but a lot of times it's both combined.
Yeah, and to get a diagnosis like that, when both couples, you know, what are the chances that two people who come together and neither one are able to conceive?
Right.
So what do you tell your patients?
It's pretty common. You know, most of these things that we diagnose are not an all or nothing, meaning we're never telling patients you can't get pregnant. That just doesn't happen. Usually there's subtle things that kind of come together and make a bigger problem, and that's what we use the evaluation for, to figure out what exactly do we need to address and fix to be able to offer that couple the simplest form of treatment to be able to get pregnant.
Yeah. What do you think are some of the most common diagnoses that prevent someone from conceiving?
So issues with ovulation are very common, things like PCOS. We have a lot of women with things like endometriosis that can cause issues. That tends to work with the fallopian tubes and blockages or issues with the fallopian tubes. And then, of course, as we already mentioned, our male factor issues, or maybe the sperm count is just a little bit low, or the sperm aren't moving quite as well.
Are you also seeing age as a factor? Are you seeing older patients coming in wanting to conceive?
We do. You know, we've known for a long time that age is definitely a factor, and as we get older, our eggs also get older, and that makes it more difficult to get pregnant. A lot of our evaluation does revolve around looking at a woman's egg number, her egg quality, and counseling patients at any given age. These are our options, and these are our success rates based on your age bracket.
Let's say we were to take a patient, she and her significant other, say both in their early to mid 30s, they're having difficulties. What is the process at that point? I mean, depending obviously on the diagnosis, but let's say it's something that has to do with endometriosis or you know, some other more common factor. What's the length of time that it would take for them to then see the fruits of their labor?
First step is always getting testing done, because the testing really does determine for us what options we have. Meaning, do we have 2 open fallopian tubes, which would allow us to do much simpler treatments, or do we have blocked tubes, which means we're going to need something called IVF. So all of that testing really takes about a month. We can get most of the testing done in about a month time frame, and so we'll have an answer for the couple at that point saying, here's what our options are, here's how long it would take, and it may be as simple as an oral medicine you take to get you to ovulate, as to something more advanced like IVF, where that may take 2 or 3 months to complete.
Okay, and so once that mission starts, what's usually the length of the time by the time they get that positive result?
So again, it's going to vary. You know, it can be quick as a month. Sometimes we have couples that it's a journey, and they go through a couple of the simpler treatment cycles, and we end up in IVF, and it may be 5-6 months down the road before we're getting the positive test.
I see. Do you see any going longer than that? And
occasionally, I mean, every case is different, obviously. You know, we do have difficult cases where patients may have more severe issues than kind of the standard couple that require more testing, more stimulation cycles, getting more embryos to find a normal embryo, things like that, where it can take longer.
And that's where you come in, so you're there to help guide them throughout that entire process.
Yes.
I have to ask this question, you know, what if you come to the end of the road and it is just not possible? That's a difficult conversation.
You know, that's the one great thing about our field these days, is that there's so many options that we really don't have an end of the road necessarily. And so we always tell patients that even if you don't have ovaries, we can get a donor egg. If you don't have a partner, we can get donor sperm. If you don't have a uterus, we can get somebody called a gestational carrier to help you carry the pregnancy. So really, we have a lot of options. It's a very, very rare day when we tell patients we're out of options.
I want to end it on that positive note, because I think that's what it's all about. I want to thank you so much, Dr. Cook, for joining us.
Thank you again for having me.
Absolutely. We're back in 2 minutes.